Then you spend 1 year for housemanship, 1 year for youth service. That's 27, 28. Then you now want to become a specialist, and you spend 6 extra years to train to be a specialist.
Okay.
It means that averagely most doctors will become 35 by the time they become specialists.
Okay.
Then they have just 25 years to work.
That's a good run, if you ask me.
You realize that
25 years of quality service
you're
delivery.
losing a lot of skilled workforce,
Okay.
skilled medical workforce. So this policy for us, it's a very good development. I think it should have even been increased beyond 65, maybe to 70 years. The reason is simple, Sam. We are about to face one of the greatest health workforce crises in this country.
And what's that?
Doctors are leaving the country. The numbers are increasing. Between 2015 to now, each year the number keeps doubling. And you realize you just wake up one day, go to the hospital, and there are no doctors to attend to you.
Dr. Diamond, you of all people should have a very big understanding of biology, anatomy, and how the body works and whatever it is classed as. And you know that the older you get, the weaker you become.
The older you get, the weaker physically you become.
Okay.
But the more productive you become technically.
Come on.
So the technical input increases.
Okay.
Because you become more experienced, and then you have more knowledge, and then you can instruct younger people, and you can be there to guide them. That's the key. And you shouldn't lose that technical input that elder colleagues bring to the system.
Okay. Again, I have nothing against the senior citizens. I have nothing against older people, because my position for this conversation would seem like I have something against them. But let me put that disclaimer out there. Doctor, I've had a surgery, right? And as you can tell, it was successful. I'm still friends with that doctor till today. We still talk, and if I, have other things, I still go to him. And he is a young doctor. By assessment, maybe looking at him, he should be in his 40s, right?
Right.
Now, if I had met a 70-year-old surgeon, even though I may not have much of a choice, but I might have had an objection. Because I know that one thing that a surgeon definitely needs is steady hands. And the older you get, let me put the disclaimer again, nothing against our senior citizens. The older I'm sure you know where I'm going. There's just something about a lack of stability that comes with aging. So, do you see how people might not feel very comfortable getting treatment or medical attention from an older doctor?
So, Sam, the question you ask yourself, the surgeon that did the surgery on you, who trained him? That's the first question. Now, if the person that trained you was no longer in the system, how would you get the skills to perform that surgery on you? That's number 2.
Okay.
The third thing is this: not every old doctor is a sick doctor. Come on, at 70, many people's hands are still okay to operate. Now, many of these people that are 70, 65, you realize that by the time you take them out of the system, what you lose in the system, you take 20 years to gain it back. And that cuts across all cadres of the health workforce. So that's why it's important you have people that are experienced, to remain in the system, to add more value to the system and bring in more technical input to the system. So this is very good. Besides, it doesn't stop the younger doctors from being employed in any of the hospitals. This country currently has 55,000 doctors, when we are supposed to have more than 400,000.
This data was from when exactly?
March 2024.
I'm sure it is less than that.
It should be less than that. 55,000 registered doctors,
because
not even practicing
some
doctors.
Doctors jackpot this month.
Some would have jackpot this month. Some are even jackpot internally, meaning they are no longer available for practice. Maybe they diverted into politics or other things that are available for practice.
Yeah.
Now, the patient-to-doctor ratio ideally should be 1 to 600 patients, but in this country is 1 to 9,000 patients. You can imagine that, Sam. Now, there's no reason why we can't understand why our health indices are falling, while our maternal mortality ratio is one of the highest in the country. Why infant mortality is still on the very high. So we need a lot more hands to be in the health system, to be able to solve our health problems.
Yeah, but Dr. Diamond, if I'm thinking about tackling brain drain, I'm not thinking about increasing retirement age. There are options like economic development, educational reforms, competitive salaries and benefits. That's definitely important. There are maybe 4, 5, 6 things that I would first point to before I'm thinking, you know what, let's increase the retirement age for those who are already in service. So why were these other options not explored?
So there are many options, but this is the low-hanging fruit that the government have just, decided to utilize, which is fine. And the NMA is going beyond this to ask, number one, for more doctors to be recruited into the system.
Okay.
Perhaps we need to start exploring innovative solutions to our problem. The key thing, like you said, the key push factor for brain drain is poor remuneration and insecurity.
Indeed.
The welfare of doctors in this country is still very, very poor. And government should look at that. There's no doubt about that. Government should look at security for all citizens, not only for doctors. Working conditions in our hospitals are very poor.
Yeah.
And I think this area still needs to look at. So what government has done basically with this bill is to harvest low-hanging fruits while they look at other areas of tackling brain drain.
Now, is there a consensus response to this by the president? Is the entirety of the NMA in support of this? Do you have doctors who might be against this?
Certainly, in every policy, not everyone will support it, but look at the generality of doctors and other health workers. Nurses are happy with this. Doctors are happy. And I think other health workers are happy. We want to believe that the various states, our own state, for instance, the governor of Rivers State, want to believe will domesticate this locally and increase the retirement age in Rivers State from 65 to 70, and then look at other solutions to the current problem. It's a serious health workforce crisis. We've not seen where we are going to, but sincerely, you go to some hospitals, there are no cardiologists, there is no neurosurgeon, there are no more physicians, there are just 2 surgeons where there are 12, and then you realize if you continue doing this, we'll get to a point when there are no doctors to attend to us.
Yeah, but Dr. Diamond, you have to admit 70 is a stretch. Come on, it just has to be, right? We're literally arguing 65. So
you see, in every workforce, there are various levels of input.
Okay.
And I think you should realize that. There are primary level workforce, that give you, the basic workforce. We call them house officers. There are resident doctors, that do most of the skilled workforce.
Yeah.
There are consultants that bring in technical input. And there are now professors that train and teach the consultants and pass across experience. We can't lose any of them. We need everybody. We need them for the health sector to grow. And I'm sure you also need them.
Of course, definitely. Healthcare is it's a basic necessity. I think that if you really think about it, considering knowledge already gained, you really can't retire from what you know and what you can teach, right? There might be an official statement and all of that, but training younger ones and just passively contributing your knowledge, that can happen till your very last day.
That's right.
But to be actively serving, to come to a hospital and see this doctor who is going to attend to you, he's going to listen to you, he's going to give advice, diagnosis and all of that. There's something about, and I know that it might seem like I'm approaching this from an emotional standpoint, right? But there's something about a young doctor. I don't know. You should know what I'm talking about. There's this vibrance. I'm going to see my doctor, right? You don't want, this is me. Let me not speak for others. You don't want your doctor to be like your dad. You want your doctor to be your guy that you can talk to and tell, if you have to bring seniority and respect and let me not to the table, you're not quite sure if you really want to open up as you should. But again, this is me, right? Others might not feel this way. Is the social impact, the social factor, not important for this conversation?
Very important. Absolutely important. But you see, there are patients that will go to the hospital and they want to see the older doctor. They are even more comfortable seeing the older doctor.
You're not losing this battle.
The more experienced doctor. And there are patients that will stick to a doctor for 20, 30 years.
Yeah, true.
And that's a doctor that when they see him, they feel happy.
True.
their problems already gone. Besides that, you need to pass across training, skill, and experience. There are experiences you shouldn't have, but you should learn from those that have had the experiences. And you know what retirement means in this country? Retirement means the person is not available to provide service and to provide training. That's what it means literally. And you need him in the system to continue to provide that. And that's why this is important.
Okay, well, you've heard from Dr. Diamond. He definitely is an advocate for this. The president has approved an increase in the retirement age for doctors and other healthcare workers from 60 to 65. What is your position on this? You can reach the studio via the number 0817-923-0002. I believe I can squeeze in one call before we go on a break. So if that call is yours, let's have it. Good afternoon, Oracle. I'm Irabuchi, commenting from London. People age differently, mind you. It's good to increase the retirement age. Please do not be against doctors jackpying because you're in London, right? That's why you want them to come to you. It is good to increase retirement age, he says. Politicians train and sustain their children abroad, and you want my own son to remain in Nigeria? Why are Nigerians hypocritical? A doctor's salary in Nigeria is nothing to write home about. Everybody has the opportunity. They should leave. Irabuchi, I don't understand. We are literally trying to save the medical sector here. You are advocating on a Nigerian radio station, sending a message from London that we should jackpot. Well, thank you, Irabuchi. Of course, that's not what we're promoting. We're hoping to have a system that works for us. We'll take a break, and after that, we talk some more. Please stay with us.
It's all talk and more talk on Nigerians' number one talk station.
Nigeria Info, Sam Oracle Chinedu here. A conversation for this hour, we're focusing on the health sector and the retirement age, as our President Bola Tinubu approved an increase in the retirement age for doctors and other health workers. It was disclosed in a statement by the NMA issued by Manir Bature, its National Publicity Secretary, on Wednesday. And I have my guest here, Dr. Diamond Tamunokuro, the NMA chairman of Rivers State Chapter. You're welcome once again, Doctor.
Thank you very much, sir.
Well, as you can tell, Dr. Diamond is very much in support of this increase. As a matter of fact, it was one of the demands of the NMA, so this is an answer to prayers. I'm not against it. I'm just skeptical about it. I'm just asking the questions that anyone who wants to attempt to be on the other side would ask. But my question for you now is, how would you feel being treated by a 65-year-old doctor? Are you concerned about age when it comes to getting quality healthcare? Do you think that it affects performance in the medical field? Or are you indifferent? You don't mind? Call me and tell me. 0817-923-0002. Hello? Okay. We'll take that call shortly. There's a message here on WhatsApp that says, "Hello Sam, say hi to Dr. Diamond. I think doctors' retirement age should be extended to 70 years. I say this because I work in a private hospital, and over time I've observed that most of our patients prefer to be seen by the older, more experienced doctors." Beauty from OGRA says, okay. Well, I mean, experience does count, right?
Beauty is right, really. Sometimes when you see the older doctors, I mean, you just feel happy. You know, you just see years of experience, training, and I've seen several cases presenting in several different ways. And then by the time they listen to you, they know exactly what the problem is.
Okay.
So this is very important.
Kurt calls from Uniport. Hello, Kurt. Good evening.
Yeah, good evening.
Good evening.
Gentlemen.
Good evening.
Yeah, my take is this. The president have lived to treat typhoid they have and begin to treat malaria he don't have. We have established that our doctors are living. Is it the problem they are living is to increase their retirement age? If it's not their problem, they have failed woefully. I think the president could have go and solve the problem in which the doctors are living in Nigeria. Because if he like increase it to 100 years retirement age, the doctors will still live in their large number tomorrow because he failed to solve the major problem that make them to live.
Okay. Now, Kurt, I need you to answer the question that I asked. Do you mind being treated by an older doctor? Does that concern you?
Age does not mean by age. Age is a number.
Okay.
Some doctors who are graduate today can perform well even more than the age you are talking about. It's not a matter of age. It's a matter of being, though experience is best teach anyway, but it's a matter of being intelligent and being active.
Okay.
Can a doctor who is in a wheelchair will treat another person that is in a wheelchair? It doesn't work that way. So age must have a way to tell your body, no matter how you pretend about it.
All right.
So I believe the president do not do well. Let him face the problem that are making the doctor not to leave.
Okay. Thank you very much, Kurt. God's Time calls from Onelga. Good evening, God's Time.
Evening, Sam Oracle.
Good evening.
Yes, I want to greet your gentlemen. Good evening, sir.
Thank you. Good evening.
See, I think that attending to me is even more preferable.
Okay.
Because presently, I am not trying to cast aspersion on our latest graduates, but you see that most of them are doing something executive, like the case of a woman dying against a medical doctor tried to use YouTube to operate her in Imo State.
YouTube.
So aside that, I think what the president has done is worthy of praise. And the president that we have actually made it 70 years. And beyond that, I think the president should look inward and increase the salary of medical doctors. Imagine what the doctor is saying, that we have 55,000 and that was as of 2024. That means the number has reduced already because so many persons have used that word. They don't leave. So I think the president should look inward and increase the salary and make the working environment conducive, and also look away and revitalize our teaching hospitals, the hospital, state hospital, and the rest of them, so that it will be able to work optimally according to the world standard. I think what the president did is good. Thank you, and do have a smart.
Thank you very much, Gus Time. Dr. Diamond, you are the NMA chairman, River State. I had to say that because I want to put you on the spot. A young doctor approaches you, someone who trusts your counsel, and says, Doctor, you're an amazing doctor. I've trained under you. I have learnt a lot, and I believe that I've attained a level of competency. There is an opportunity for me to leave this country to practice, and they are offering me something that is way better than what the system here offers me. What would you tell him?
I would tell him clearly to take his decision. It's clear because you see, remuneration is a key factor in retaining health workforce.
Sure.
And it will surprise you to know that many doctors in this country are still paid as low as 150, 200,000. That's just about $100 in a month. And if he sees an opportunity outside that pays him $1,000 or $2,000, then you realize the attraction is much for him.
Yeah, it is huge.
Coupled with insecurity and the work environment is not optimal. So many young people would decide to think otherwise, But he needs to look beyond the immediate factors. You really need to be a lot more optimistic than normal to remain in this country.
Okay.
And that's why I think that every doctor you see in this country truly are the true patriots of this country. Because every doctor in this country has an opportunity to leave. But those of us that decide we should stay behind, we had far more than optimism.
Okay.
Believing that the country will get better one day.
So
believing that the health of the citizens, including the health of some, is important and should be prioritized. And that's why we are here.
Dr. Diamond is diplomatically blowing his own trumpet. That's what you just heard. But thank you very much. Lawson calls from Yenagoa. Hello, Lawson.
Sam, Oracle, greetings.
Good evening.
Yes, the doctor. I don't know, what is it that the Nigerians here, they want to work until, if you allow them until even 100 years. Nobody wants to retire. What is it about retirement? Even doctors that do lots of private practice. As you see doctors, so they work most times in 2-3 hospitals in one day. I'm telling you, especially consultants. In fact, I met one consultant. It was a cardiologist. He told me by the time I was seeing him in one of the hospitals, he said that third place he's visiting in that same day. That was at night. So everybody is 65, like the judges, is even 70 years. I don't know really. It's a very funny thing. That like if you go to Europe and other countries, sometimes they want to even retire early so that they can have enough time for themselves. That's right. What they do elsewhere. But in Nigeria, yeah, even during Buhari's time, teachers, and you look at the other time in the United Kingdom, doctors were on strike for a long time. What was the reason? The remuneration was part of it. Tax was part of it. This was the case. So we always feel that there is bad. I'm not even against them traveling out, because if they don't travel out, with the amount of doctors who are turning out in this country, I am telling you, most of them will remain unemployed. So they even really need to go out, but not to say they are going out because the country is bad, this is bad. No, that 100 and something talking about is private hospitals that pay that.
Okay.
Not government hospitals.
Lawson.
And again, please, quickly, health is under concurrent list. So when we talk about federal, we should also talk about states. Thank you.
Okay. Hold on, Lawson. I had a question because you haven't answered that one. Are you concerned about the age of the doctor that attends to you? Is that a concern for you?
It is a big concern now. Don't forget, the brain is fresh when you are young. Your brain naturally is fresher when you are young.
Okay.
From 60, you begin to have issues with memory. Sometimes I have an uncle, he's about 62. He's always been people with deal with that person.
Okay, thank you, Lawson. I'm sure that we also know people who are in their 60s or 70s who are, still sharp. So while that's not absolute, but I'd like you to respond to his position on remuneration. He says that certain doctors who are in the employ of government earn better.
Yeah, I think there are many things to respond to. First is that the number of doctors we turn out in this country on a yearly basis is about 3,000. Now we have a deficit of much more than 300,000. So when Lawson tells me we have more than enough doctors, it means he doesn't have access to proper statistics. We don't have, and we need more. And I think one of the things government will do going forward is to see how we can even bring out more doctors. That's number one. The second thing is that to assume that every person, every professional at 60 becomes weak, cerebrally, it's also a wrong assumption, really. Some people don't forget that technically comes with age and with experience, Then there's something called voluntary retirement. Let's not forget that. This is government's compulsory age at retirement. It doesn't mean that when you're 60 and you want to go, want to retire on your own, you can do that. Nobody stops you from doing that. But what we are saying is that government is being intentional to retain health workforce in the country, and that's why this policy is in, and is a very good policy.
All right, we have Jude from Omuma. We've lost that call. Okwando from Irebe. Hello, Okwando.
Yeah. Good afternoon to you, the Oracle.
Good evening, Okwando.
Yeah, you see, I want to ask one question with our local balance.
Okay.
We don't make our years. Now, 65 years when you go make them.
Well, no, that doesn't apply because he already made it at 60. No.
It applies.
It doesn't.
Because if you go to advanced countries, you see people that will work for 20 years, 10 years, they have made a mark in the industry where they are. Some will go and so on. Instead, government should make the environment conducive for people. Look at how the number of the population of the country is escalating every year. People are graduating from the university. They are also looking for jobs. They also need opportunities to make impact. I think that could have been better than increasing age to 65 years.
Okwando, let me ask you. Hello, can you hear me? Hello?
Hello?
Yes, can you hear me?
The network is checking.
Oh my. Okay, I hope you can. What is your definition of a doctor's impact? If you say a doctor making impact, what does that mean to you? Okay, I think he cannot hear me. Thank you very much, Okwando, for calling. Oh, we have lots of messages. You want to say something, Doctor?
Yes, just to respond to the two things he has mentioned are not mutually exclusive. Improving working condition of doctors, improving remuneration, it's not mutually exclusive to increasing retirement age. These are all, measures taken to mitigate the Japa syndrome. And like I said earlier, we are gradually tilting to a very serious crisis. People have not realized this, but in the next 10, 20 years, if what we are seeing continues, you realize that the health sector in this country will gradually crumble to a standstill.
I hope we never get there. I hope we can solve these problems before we get there, because that would be devastating. Okay, let's take messages. Sam, what is going on in... Okay, no, that's not for us. Good evening, Sam, and the guest. It's a welcome development to increase doctors' retirement age. The number of years of practice is proportional to the level of experience acquired. All right, thank you very much. The concept of active service needs to be re-evaluated. While acknowledging the need to inject fresh ideas, employers and the government should provide a comprehensive package to honor the intellectual contributions and financial sacrifices of veteran employees. In Nigeria, the prolonged process of acquiring certification, including JAMB exam, frequent strikes, delayed graduation, warrants a reconsideration of the retirement age, given the extended time invested in education and career development. That's exactly how you started. You talked about
exactly
how long it takes to just become a doctor. That's from Merdick. Ike says, I prefer seeing older doctors than younger ones. That's Ike from Eneka. And TK says, I'm a Nigerian student. As much as new innovators are coming up in the medical line, I believe that our old doctors still read these new innovations that this century and the so-called Gen Z doctors now are having to build their own knowledge in the medical field and the likes. So it's okay for older doctors to still be on the field. Then again, some families, some men would not like a young doctor attending to their wives, but will be okay when an older doctor does. Do you guys have these experiences?
Yes, we do. We do, absolutely. In various fields, really. Some people are just comfortable with particular gender. And sometimes you meet some cultural preferences. Yeah. For example, those of them in the north, for example, the female patients will prefer female doctors.
Yeah.
Them, so these things exist, and you can't take these things away.
Okay. Daniel calls from Eneka. Good evening, Daniel.
Yeah, good evening.
Good evening.
For me, I think it's a 50-50 thing.
Okay.
The older doctors are better so that they can tutor the younger ones. Because I had an experience when my elder sister was sick. When the younger doctors tried, and there is an elderly professor doctor that came, she had a second-degree burn. The man now recommended some fruits and some pills. And that was what picked her up.
Okay.
And the younger ones have to learn that, okay, this is how he did it, this is how he did it. So it's a mixture of the two. There are brilliant young doctors. The elderly ones they're okay. They're okay because you need them in the society, no matter how you do.
Yeah, I agree.
You cannot take away their experience. But for the Jackpot syndrome, I think the 65 years is not the solution. It's part of the solution, but it's not. They should pay doctors well. Let them pay these people well. They need to be well paid. There's nobody that you pay well that will not love his job. Nobody. You should pay them well. They deserve it. I'm not a doctor, but they deserve it.
Thank you very much, Daniel. We'll be taking what I believe is a final call, and it's from Temple calling from HA. Good evening, Temple.
Good evening, the very distinguished Amara Kuchinek.
Good evening.
I'm
amazing. Please go ahead.
I think I would say it's indeed a welcome development. But looking at the age, which I think increasing the work timeline is not a bad idea. But for me now, it will be a bad idea if this 65-year doctor is not giving some kind of good welfare package to keep the medulla oblongata focused. Because it will be very disastrous if the man is treated bad and going to handle a critical case. Brother, such a person will not live to tell the other side of the story. So I think the government should focus more in treating and giving them the good largesse as they are giving to the other sector, most importantly, those in the judiciary. Thank you so much.
All right. Thank you very much, Temple. Let's do justice to our messages. Experience, they say, is the best teacher. I think I find comfort in the older doctors. Likewise, my parents, too. April says. Owanete Clinton West. Good evening, Mr. Simon, the doctor in the studio. President Tinubu increasing the retirement age is a good step because most medical doctors and other health workers who are retired but not tired can still be useful in their services. This is acceptable, Owanete says. And Irabuchi says, Dr. Diamond, you're a good man. Oracle stopped reading my message because of my stance. Yes, I did. We are on Nigerian radio. I work in Nigeria. My guest is the NMA chairman, and you're heavily promoting Japa on my show. I had to stop, my brother, but thank you very much. Increasing the working age of doctors in Nigeria is not a good idea at all. The reason the doctors are already overburdened, overworked. Some of them even have their private hospitals and are partners with other private hospitals. We must not kill them slowly. Retiring them early will pave the way for freshers to get jobs. My candid thoughts. Bishop from Oyibo. Well, Bishop, while that is a valid stance, our doctor in the studio says that we do not have enough. Extending the retirement age will not stop, new doctors from getting into the system because there is a deficit. We literally have 2 minutes left. Dr. Diamond, when will this be implemented? How soon?
I think very soon. The coordinating minister for health and social welfare would have to present to the head of service.
Okay.
I want to believe in the next few weeks this will be fully implemented.
All right.
But that's not enough, really. While we tell government thank you for doing this, there are more things government needs to do.
Indeed.
Remuneration is what we've talked about repeatedly. Government needs to look at the commerce structure and improve on what doctors take home, which is very key. Then improving the standard of working. I think there has to be a way to increase investment in the health sector. Let us take lessons from what the Indians did. The Indians had Japa, at some time in their development. But what did they do? They sat back and decided how they can reverse it. And now they've reversed it almost successfully.
Yeah.
Now, most people travel to India for medical. People move from Europe to India to receive medical care. Why? Because there was government intervention, intentional intervention,
all right,
to bring policies that would make sure that equipment, when it's produced from Europe, lands in India almost the same year. And these are the things that government needs to do.
So we're almost out of time. Thank you very much, Dr. Diamond, for your time.
Thank
Truly
you,
appreciate it. I'm certain when we have other conversations from the medical sector, I'll reach out.
Always available for you.
Have a wonderful day, sir.
Thank you.
You are tuned in